time and effort that you're putting into this. We really, really appreciate your insight and your assistance. I'm Mary Ann Martinson. I'm on the board of the Howard County Autism Society, and I have a 21-year-old daughter on the autism spectrum, so that's why I do this. And I am so delighted that I get to be the one to introduce all of our amazing panels today. So what we're going to do is I will go ahead and as each panelist or group of panelists is about to speak, I will introduce them, read you their bios. We will let each group or each individual do their presentation. And then at the end, we will have time for questions and answers. And in the interim, if folks who are not speaking could put themselves on mute. And if you have any questions or need any assistance in the interim, I guess we go ahead and have you put that in the chat. And before we get started, I just wanted to let Suzanne and Melissa know. Oh, there's Brenda.
I'm so sorry. I mean, I'm panicking, right? I'm like, oh my God, I don't have web thing. I don't have this. I don't have, but I'm calm. I'm calm. So.
Thank you. Thank you, Brenda. We'll go ahead and get started and we'll let you relax and calm down before you have to speak. How's that? Terrific. Well, I am so excited to introduce our first two panelists. They will present together. They are both amazing doctors from Kennedy Institute. First, let me introduce Dr. Andrea Goddard. I will read you her bio. It's so amazing I could never remember this off the top of my head. So Dr. Andrea Goddard is a licensed clinical psychologist. She's a postdoc supervisor in the Child and Family Therapy Clinic at Kennedy Krieger Institute. She is the director of the DBT program, the Dialectical Behavior Therapy program at the Child and Family Therapy Clinic. The DBT program includes group therapy, individual DBT informed treatment, and a bi-weekly consult group for both postdocs and interns. She is also responsible for developing the training curriculum for the psychology trainees. Along with Dr. Goddard, we have Dr. Christine Dube. Dr. Dube is a licensed psychologist in the Pediatric Developmental Disorders Clinic at Kennedy Institute. She specializes in the treatment of problem behaviors in children and adolescents with developmental delays. She is a postdoc supervisor and oversees social skills group treatment for the trainees. Today, Dr. Andrea Goddard and Dr. Christine Dube will discuss, amongst other things, how families can work with their therapists and create a safety plan in writing that has preventative strategies and strategies for other professionals to follow in case of an escalation. So I am very, very pleased to introduce Dr. Andrea Goddard and Dr. Christine Dube.
Hello, we are so excited to be here.
Thank you.
What we decided to start out with today is just a little bit of description about who our clinic sees, since we specialize in a little bit different things, and then we'll start out by talking about, some of the things that you can do leading up to a mental health crisis, and then what ways that you could potentially kind of walk through a mental health crisis. So just before we kind of dive into things, we want to say, some of these are general recommendations, and definitely work with your child's therapist to tailor things to meet your child's needs, because everybody has unique things that they're working on. And so these are just some general things that we think would be helpful. So like Mary Ann said, I am in the PDD clinic. So my clinic specializes in working with children and adolescents with autism and developmental delays. So we see quite a few kids who come through our clinic who have anxiety, depression. Sometimes we treat OCD symptoms. So we kind of see a wide range of things. And my clinic's a little bit different from Dr. Goddard's in that we work with kids who are maybe have a little bit lower verbal skills. So we're really more trained in working on some of those preventative strategies. So before we get to those crisis moments. So one thing that we thought would be kind of helpful for us to talk about is, how do you how do you kind of get to the place of being able to plan for these things? And, as a parent, you're one person, so being able to find somebody in your community that can really work with your child and help you guys along the way is really important. So you know what's typical behavior for your child. So how to it varies by child, but knowing what's typical behavior for your child and when do I need to reach out and get some more support. So for a child who has less verbal skills, that might be that their behavior is changing, maybe they're more irritable, their sleep patterns are changing. Those are all really important things to be keeping an eye on. Sometimes anxiety looks a little bit different in kids with autism. So maybe you see more rigid behaviors. Maybe you're seeing more behaviors that are just kind of outside of their norm. Those are times where you might consider, should we pull in other professionals? And so what that might mean is looking in, your community, seeing if there are psychologists, social workers, somebody who's licensed to work with children and adolescents who have autism. And so getting that support in place so that you're not trying to decide what to do alone. And then also
Christine,
yes,
Christine, can I just add one thing? So
absolutely.
Well, and so this is a good segue. So while Christine's clinic deals with the population that she just mentioned, the clinic that is basically operating in the same building is the clinic that I work with, and that is child and family therapy. And so what we really specialize in is children across the whole age range from 6 to 26 years old. As long as they're on their parents' insurance, it is fine. With pretty significant internalizing and externalizing challenges. Children who are on the higher end of the functioning of the autism spectrum. So what really is helpful is if they do have some verbal skills. It's not a requirement. And what I will say is that Christine and I have collaborated and consulted with each other many times, have transferred with each other many different types of families who have different types of challenges. So as things continue to escalate, hopefully it doesn't escalate to the point of hospitalization. And we're going to talk a little bit about how to prevent some of that and what warning signs can look like and even what steps we can take in order to sort of de-escalate. But the nice thing about Kennedy Krieger is that we have access to different clinics and different types of therapies. And so while we work with each other, we can also provide a slightly different type of comprehensive care. So I just wanted to add that.
Yes, thank you. That's very helpful. And so when you're working with a provider, making sure that that provider is a good fit for your family. So making sure that that experience is there with the autism community, because kids with autism definitely have a different way of communicating and a different way of interacting with those around them. And so you need somebody who knows kind of how to work their way around some of those challenges and be able to best serve your child. So another thing that we, think is important is, considering, is medication important in this child? So a lot of times we know that medication and therapy are the best intervention for, mental health crises moments. So, getting in connection with psychiatry is also a really important step for a lot of teens. And then Andrea, do you want to talk a little bit more about?
Sure. So I was going to talk a little bit about safety planning and emergency services. And so ideally, in the perfect situation, there would be a safety plan in place that could prevent or serve as enough support in order to de-escalate any escalation, whether it is a behavioral escalation, an emotional behavior, or an emotional escalation, understanding the function of that and working with your therapist prior to needing to access these emergency services is often recommended. So early on in treatment, what we often focus on for children, for adolescents who have any type of emotional challenges or have presenting concerns where it does seem to be escalating to a place that is beginning to get even a little bit harder to manage, we'll oftentimes slow things down and we'll go and discuss how we can create a plan to de-escalate. We call them safety plans. It can be called anything that your family likes, anything, as long as it's something that is a term that can be referred to and then a tool that can be utilized when we are experiencing an escalation of emotions and behaviors. And the idea here is not to just create a document that is just going to sort of get lost in the shuffle or just, you know, sort of disappear. But the idea is that it's a working plan. And oftentimes these working plans include people who can provide direct support to the teen or to the child who is working through their challenges. And what we often like to think about is warning signs. So any potential nonverbal behaviors, like Christine mentioned, whether it's increased irritability or increased isolation or increased aggression, anything that you're starting to notice that is a little bit atypical for just the given day, that would be a good idea to start to think about, how can I access these services? How can I access the safety plan? And when I say services, I don't mean now calling mobile crisis. I mean, how can I access the resources that we have already delineated? So rather than waiting for the crisis, it is proactively engaging in some of these tools. So once these early warning signs have started, it's also, and one more thing I meant to just identify is listing out some of the triggers. Now, the goal is not necessarily to mitigate or to control for all of the environmental triggers, because it's honestly impossible. The goal is actually to create an environment that is safe. So that may mean removing any harmful or sharp objects or potentially dangerous objects. But again, we don't live in a bubble. And we don't expect families to create a bubble. That's certainly not what we're aiming for. But the goal would be that if you know a child tends to reach for heavy, hard objects and throw them or hurt themselves with them, it would be to remove those, or knives, or any cleaning products, anything that could potentially be dangerous, and just put them out of reach. Make it harder to access. And it doesn't, again, have to be locked in a safe. They don't have to be locked in a safe. It's just limiting the access can greatly improve someone's chance of de-escalating, of calming things down before additional outside support needs to be accessed. So again, it's the triggers that we want to pay attention to. It's the symptoms, the early warning sign. And then let's say, you know, it's not perfect. Things happen. We escalate to a place where it is not that easy to calm down. Maybe these tantrums or these outbursts are lasting an hour or even longer. And so then what do we do? And so the idea behind a safety plan is not only a working document for the family to mitigate the risk, but it's also a working document for any outside support, whether it's mobile crisis, whether it is the police that need to be called. The idea is that when children with autism are, let's say, confronted or are assessed by people like the police or like mobile crisis, they're just going to do what they're trained to do. But that might not always be the most useful, correct thing. What police are trained to do is be direct, be a little bit, you know, a little forceful in their nature, maintain eye contact, have a close proximity to the individual, and all of these things can be extraordinarily triggering and escalate things further. So the goal would be on the safety plan to indicate what is preferred, what is going on, what is helpful, so that when the whole family is in crisis, because oftentimes as the child is escalating, other family members are also escalating. This document can be presented to the external help, and it will help them, whether it's a police officer or whether it's a mobile crisis member, understand how to de-escalate a little bit more effectively. Now, it's not perfect, but unless they're given the tools, unless they're told what to do, they are just going to do what they're trained to do, which doesn't always work. Anything you wanted to add, Christine?
No, and I think it's good to have just my quick ad before I know that we are out of time, but you have multiple copies of it, laminate it, put it you know, by the door, put it on the fridge, have it, you know, easily accessible so that nobody has to think in a crisis moment, that everybody who comes into the household knows this is what we're supposed to be doing right now. And, you know, I think it's a safe thing to identify your child or, you know, adult as being on the spectrum, because then emergency services are going to treat the situation differently, and that's important. And that is all.
Thank you both so much. You are a tremendous resource and a wealth of information. We really appreciate your words of wisdom. Much appreciated. Thank you both so much. Next, I am very pleased that we have representatives from Sheppard Pratt. And again, I will read their bios. They are incredible. I could never remember all of this off the top of my head. We are pleased to have Sara Uram. Sara is a social worker in Neuropsychiatry program at Sheppard Pratt. She obtained her Bachelor of Science degree from Towson University. She earned her MSW at the University of Maryland School of Social Work. Sara was trained at Kennedy Krieger Institute and completed the Maternal and Child Health Leadership Education in Neurodevelopmental and Other Related Disabilities program, that is the LEND program. She is passionate about working with transitional age youth and young adults with autism spectrum disorder and other neurodevelopmental disabilities. Thank you very much, Sara, for joining us. And along with Sara, we are really pleased to invite Dr. Robert Wisner-Carlson. And Dr. Wisner-Carlson is chief of the Autism and Neurodevelopmental Outpatient program at Sheppard Pratt, a senior psychiatrist and service chief Adult Intellectual Disabilities and Autism Unit, clinician investigator for the Sheppard Pratt Autism Registry, and he also chairs the Sheppard Pratt Ethics Committee. He's a graduate of the University of Michigan Medical School. Dr. Robert Wisner-Carlson trained in psychiatry at the Henry Phipps Psychiatric Clinic at Johns Hopkins Hospital and at the Maudsley Hospital in London. He holds a specialty certification in behavioral neurology and neuropsychiatry from the United Council for Neurologic Subspecialties. He is double board certified in general psychiatry and neuropsychiatry. Amazing. We're really pleased that we have both of you here today. And Sara and Dr. Wisner-Carlson will talk about autism through the lifespan as it relates to other psychiatric comorbidities, as well as case management and service coordination throughout the lifespan. Thank you so very much. We're pleased to have you.
Thank you very much for inviting us. We were pleased to be re-invited. I guess we were here 3 years ago. And I know what we're going to have a little presentation. I think the important thing I learned from 3 years ago is giving time for questions, because it's always, the issue is always knowing what's on people's minds and saying things in a way that answers people's questions. But I have a little slide presentation. I guess I'll go ahead and show it quickly. Let's see. Is it? Yeah. Is it going? Yes. Okay. So Sheppard Pratt, as there we go. That's me. And you know, Sheppard Pratt provides a huge amount of psychiatric and mental health services, as well as school services and social services. And of course, the developmental disability issues, neurodevelopmental issues, autism issues are part of what Sheppard Pratt provides. We provide a huge number of services across Maryland for at all levels of need. So this is Sheppard Pratt in general. We have sites in Baltimore City and I think 16 different counties through Maryland. We have various services. Again, these are the general services. We have crisis and admission, inpatient specialty services, community and family supports. And of course, not all of these are for people with autism, but we're in our autism work group trying to figure out how to make Sheppard Pratt, how to provide autism-informed care, how to support autism-informed treatment at Sheppard Pratt. So this is part of the reason I show you all of this. This is the new hospital that's going to be opening in Howard County in Elkridge in July. Very, very beautiful hospital. Sheppard Pratt has 13 different schools and throughout Maryland, 7 of which specifically are for children with autism. And we have psychiatric urgent care, both virtual and in-person, currently in Towson, and we will in Elkridge in the Baltimore, Washington location in Elkridge. The specific autism and neurodevelopmental services that we have are organized around mental health needs and educational needs. We do have some vocational and residential services in our community programs, but the bulk of our services are focused on mental health needs. And Sara and I come from the Outpatient Autism and Neurodevelopmental program. I'm the chief of that. We have 2 adult psychiatrists, 1 plus child psychiatrist. We're adding another in September, a neuropsychiatrist, which is me, 2 psychiatric nurse practitioners, and of course Sara. And of course we need to add more therapists to our program. We have, as you probably know, 2 neurodevelopmental inpatient units. Some people call them the neuropsychiatry units. We have a child and adolescent unit, 12 to 14 beds, and an adult unit, 7 beds. And of course, this is very unique. Just a handful of these units across the country. And so we're very proud about that. I know it's very hard to get into these units, but at least they exist. And again, we have 7 autism-focused schools that is for children, students with autism, and 3 additional schools where there's an included autism program. We accept all children and adults in our mental health programs. We're especially interested in our outpatient program about transition age youth, all levels of functioning, all levels of intellectual capacity and verbal capacity. Again, we're focused on mental health and psychiatric diagnoses. One would be coming to our program because of comorbid psychiatric diagnoses. But we also are interested in specialty disorders, including genetic syndromes. We have a Down syndrome clinic that Dr. Warren has run for about 15 years. Other genetic syndromes, we work with specialty providers at Kennedy Krieger. Dr. Smith Hicks, for example, comes to mind in collaborating. So we're looking at the full spectrum of autism and neurodevelopmental programs. We take all insurance except Champus, I think, is sometimes an issue, but and self-pay. There were questions about, I believe, about depression and bipolar disorder in autism. And unfortunately, I can't see if people are shaking their heads or not, the way the share screen is. So I hope that I'm focusing on the right things. So in depression is a combination of sad and irritable mood, change in interest level, change in self-esteem, guilt, feeling bad about yourself, change in vital sense, energy, appetite, concentration, sleep, usually low energy, poor appetite, or increased appetite, trouble concentrating, trouble sleeping, and then change in behaviors. And we can get more into this in the question and answer period. And mania is just the opposite, elevated or irritable mood or labile mood. Again, a change in interest level, usually more interests, a change in vital sense, increased energy, increased hyperactivity, a change in appetite, sometimes weight loss, trouble concentrating, a decreased need for sleep. That is a very key part of the diagnosis in our thinking about the situation. And a change in sexual behaviors, we often see agitation and aggression. That is my part of the presentation, and I'm going to stop sharing my screen. I don't know how to stop sharing it.
At the top of the screen, Doctor, there should, if you hover over there, there should be an orange button that says stop sharing. At the top in the middle.
Ah, I see it.
Got it? Okay, good.
Got it. Thank you. Yep. Okay. And I'm going to mute myself and hand things over to Sara.
I'm gonna unmute myself. Thanks again for having us participate in this discussion. I've been lucky that in the past 21 years, I started off my career as a social worker at the Forbush School and their preschool program. So I've gotten to see the lifespan of autism from preschool into geriatric age. And as we're talking about, psychiatric crises and triggers, to remember that that psychiatric crises can be triggered by medical concerns. They can be triggered by transition, sensory, trauma, difficulties with communication. Now in my role of working with adults and transitional aged youth, we see initially that there's crises and challenges through that initial transition from the pediatric school-based services into the adult services. But that's only the beginning of it. There could be difficulties with graduating from college, for changing careers or changing employment, getting a new supervisor, change in interest, seeing individuals that you grew up with moving on and getting on with their lives, getting married, having kids. And recently we've seen a couple issues of people getting ready they want to retire and they're saying they're done work, and behaviors are coming up for that. So, looking at the function of behavior, looking at how to support the individual, for me, I can't do it without the support of their support staff, whether that's residential support staff, whether it's personal supports, whether it's families and caregivers. They all play a really important role in my therapy sessions and treatment. So, we talk about things like learning to identify signals of crises early, knowing what the triggers are, what the behavior changes are, to see if we can address them before they get bigger. Teaching strategies for self-regulation, positive behavior supports, working with caregivers, family members, support staff to be consistent in the way that they're responding. Can be a really challenge because there's a lot of different players that come in, whether it's the day program, through the home, through additional supports. So that is one area that we really work on, is to have that consistency. Using visual supports is a huge part of my treatment, and just help for reminding, even for those that are highly verbal. And one lady I worked with, really, when she got so overwhelmed, she needed to go take a walk, but she couldn't go through the steps to be able to get out of the house. So we just had listed down the steps that she needed to do. Grab your keys, grab your coat, put your shoes on, and go for a walk. And that helped her work through that issue so that she could take a break and get back to work. And, taking a break and getting back to work. I work with a lot of people that they push and push and push themselves until they have a meltdown. So a lot of our strategies that we work and talk about are taking a break before you get to that point. And so, in doing so, you can usually return back to the activity. So it's not having, just a behavioral crisis. It's more of, I need to take a break now. You get out of the situation and you're able to transition back into it. Also being able to work with a variety of people in the clinic, as well as with Sheppard, Pratt, and Whole, working with OTs and speech and language pathologists, and community resources. Increasing social connections is a huge thing. We talk about one of the things that we found is having a plan after school, building those connections before that happens, taking advantage of some of the programs that are out there through like DOORS, their pre-employment services, gaining experience in work and social situations, and learning how to navigate some of those softer social skills. And, in an ideal world, we would have, behavioral supports throughout, in behavioral supports within the community, behavioral supports, as was said before, like with first responders and teaching them how, as well as just other medical providers that once we transition to adult services, we move outside of the pediatric developmental disability world, and helping adult providers to be able to incorporate and be sensitive to the needs of individuals with autism and other neurodevelopmental disabilities.
Thank you so very much. It's amazing the services that you offer. And I just love how you talked about the continuum of care. I mean, that's so very important, and a tremendous resource for our population. And I want to thank you, Sara, and thank you, Dr. Wisner-Carlson, for all of your tremendous knowledge base and information. And thank you for joining us. We're going to move on to our next speaker, and that is Denise Giuliano. All right, there's Denise. I will also read you her bio. Denise is the Executive Director of the National Alliance on Mental Illness, which is known as NAMI. So she is with NAMI of Howard County, and that is a position that she has held for 3 years. Prior to NAMI Howard County, Denise did extensive volunteer work for the Community Action Council's Head Start program and for the Howard County Public School System. Her professional background is rooted in public policy, having worked on Capitol Hill for 6 years and as an education and healthcare lobbyist for 2 years prior to raising her family. The most meaningful part of her role as executive director for NAMI Howard County is helping individuals and families get connected to mental health resources and support so that they can understand that they are not alone in their struggles. Denise, thank you so much. We're going to turn it over.
Oh, thank you. Can you guys hear me okay? Yes? Can you hear me?
You sound fine.
Okay, good. All right, thank you so much. So my personal role is that I am the mother of 3 kids in the school system, one of whom was diagnosed with PDD-NOS. I'm not even sure if they still use that term anymore, when he was 3.5, and next week he graduates from high school, which I am getting emotional just thinking about it because it's been a long road, but he's doing well, and he's one of the reasons I do this work. So NAMI Howard County, I like to think that we are kind of the equivalent of what the Autism Society does for families of kids on the spectrum. We help families living with mental illness and individuals living with mental illness work through recovery. We provide that through education programs, advocacy, and support. And the best part about all our programs is that they're free. Okay, next slide. So obviously we're all here today because we understand that there is a connection between autism and mental health conditions. Developmental disorders like autism differ from mental illness in several important ways. Developmental disorders generally appear at birth or in early childhood and are diagnosed usually by the age of 18. Mental health conditions, by contrast, are typically presented between the ages of 14 to 24 is when most of them are apparent. While mental illness doesn't typically interfere with cognitive abilities, a developmental disorder may impact a person's ability to learn or understand certain thoughts. And as we all know, many individuals on the autism spectrum have co-occurring mental health conditions, such as ADHD, anxiety, OCD, or depression. Next slide. So I mentioned that the ways that we serve the community are through education, advocacy, and support. And so we offer 3 education classes. Our family-to-family class is our most popular. It helps families understand their adult family member's illness. It helps them learn how to support but not enable. Our peer-to-peer class is for adults living with mental illness. It helps them how to live in recovery, or teaches them how to live in recovery. And then our basics class is a 6-session course for parents and caregivers of school-aged kids. And pre-pandemic, we had been doing some of that in person, and we will be getting back to that. The first 2, family-to-family and peer-to-peer, are live on Zoom right now. We typically do them in the spring and the fall, but we can do them more frequently if they're needed. But Basics is offered on demand through NAMI.org, which is our nationals website. And the nice part about that is you can hop on and hop off at any point. And it's a great class to help parents really understand the different mental health conditions and how they can support their child or the child they're caring for. Next slide. And continuing with our education, we offer education forums, which are bi-monthly programs about community awareness. And in fact, we are going to be welcoming one of Sara's colleagues on Wednesday, May 26th, which is next week. Jenna Bernstein is a senior social worker at Sheppard Pratt, and she is going to be talking. We're having a Zoom presentation for her to talk about ways to support youth and young adults through the mental health challenges of the pandemic. If you're interested in that, you can register on our website, which is namihowardcounty.org. And of course, all of this information is at the end of my slideshow, our contact information. We also do a program called In Our Own Voice, where our adult volunteers share their stories, other very, very powerful stories about hope and recovery. And we also participate in training for the police. This goes back to what Dr. Goddard and Dr. Dube were talking about with the importance of the police being trained and understanding how to de-escalate and to work with people who may be triggered by lights and sirens. And I'll have another slide a little bit later that helps families. It's one of the slides that we offer that we show for our family-to-family class, and it's a slide about how parents can be a little more prepared when dealing with law enforcement. And we also offer various mental health programming in the schools, faith-based organizations, and other community organizations. The second function of NAMI is our support programs. All of our support groups are online right now. We have a family support group for adult family members and friends of an adult. We have a parent support group for parents and caregivers of school-age children. And then we have a transition age youth support group. And we generally consider that ages 16 to 26, but it's pretty fluid. And that's that's actually taking place right now as we're speaking. So those happen once a month, except for our next slide, which is our the other programs that we offer for adults living with mental illness. So it's called our Connection Support Group. We offer that one twice a month. And we just recently started a support group just for veterans, which was really exciting. We're the only affiliate in the state that offers it. And right now it's on Zoom, so it's wonderful because vets from all over the state can join in. So we're very happy about that. It's something that was desperately needed in Howard County. So I mentioned they're all online, and registration is required and can be done through our website. Another source of support for our warm line, I just forgot this part, is it's our warm line. People call in and we refer them to different resources in the community. And we also get a lot of calls from families that are struggling, and we try to be there for them in that way. We may not completely understand what they're going through, but our goal is to help people feel that they're not alone. I think, as with many families with autism, it's similar with those families with mental illness. It can be very, very isolating when your child is the only one getting in trouble at school, and it feels like everyone's looking at you like what a bad parent you are. And so we get a lot of calls like that too. And most of us are parents on staff, and so we get it. And the goal is so they know they're not alone. And then the next slide is our advocacy. We have a public policy agenda that's generally determined by our national office, and then our state agenda by the state, by NAMI Maryland, which actually happens to be located here in Columbia, so that's a little bit confusing sometimes. Our state affiliate is here. So they organize an advocacy day in Annapolis, which is usually in late February, and we organize all our volunteers. I'm sure you do something similar. And we talk to our legislators about issues advocating for better medical services, equal insurance coverage. And then we also offer a SMARTS training, which is an advocacy training. So it's about a 3-hour training, free, that we typically do right before our advocacy day. And it just helps people be able to tell their story in the very short time that they're going to have with the legislator. It kind of helps them hone the details, and it's a nice way for them to understand what's going to happen on Advocacy Day and how best to share your story. NAMI Maryland, our state office, has been working on different work groups looking at things like bed availability, ER admissions, and crisis beds. You all know that we can always use more of those, and it's a statewide, in fact, a nationwide problem, really. And so we are going to be getting some relief from the Sheppard Pratt, the new facility in Ellicott City that the doctor talked about. And my understanding is for adolescents, there's going to be 17 crisis beds and a child and adolescent day hospital for 20 kids at a time. So a day program where adolescents can come and get some therapy during the day. So we can always use more, but that's great news that it's going to be opening soon. The next slide is what I was mentioning earlier about what to say to the 911 operator if your loved one is in crisis. We work very closely with our police department, and I think we are lucky here in Howard County. The last I had heard, we're over 60% of the officers were trained in crisis intervention team training. And so they are trained. It's a week-long training that NAMI participates in. And many various, grassroots does. There's a number of different organizations throughout the county that help in this training, and it helps these officers understand how to answer these types of mental health crisis calls. So this is a good kind of checklist on what to have and what to think about, so that during a crisis, when everyone's emotions are high, these are good things to be able to tell an officer. Probably not in front of your loved one would be the best way, but it's a good something to be thinking about that you can tell them as they answer the call. And also the next thing, many of you probably know about flagging. Oh, do I not have the flagging slide? There it is. And we also encourage families to participate in the flagging program. You can have your address flagged so that officers, when a 911 call comes in, they know that there may be a person at this address that has some mental health challenges or needs needs a softer approach. So this is providing this type of information ahead of time can be one less thing that a family needs to think about in a crisis. So we definitely recommend that families do that. And then my last slide is just a resource slide. Seeing some of the questions that came in, there were a couple of questions about TAY, helping to young adults transition. So the Maryland Coalition of Families had some good information about TAY and Healthy Transitions program through Humanum. One thing I forgot to put on here, but I believe is going to be included in the slides. The Howard County Health Department, the Bureau of Behavioral Health, puts together a mental health resource guide. And in that, because I know one of the questions was a list of providers other than just Kennedy Krieger that for psychiatrists and mental health providers. And there are three pages of psychiatrists alone, and usually in the guide it will explain what they specialize in, what insurance they take, and then there's also psychologists listed, other therapists and social workers listed in there. So it also has a lot of different things, a lot of crisis numbers in there. It's an excellent guide to have on hand. So I should have put that in my list here, but it is going to be attached in the rest of the materials that we send. So the last slide is just my information. There's my email. I thought it was on there. So if you have any questions or anything you don't feel comfortable asking in this forum, I'm happy to field any sort of questions that you have. So thank you so much.
Denise,
we'll be sharing all those too. Yes.
Right. Yes. Thank you, Melissa. We have a lot of great information to share, and thank you so much for providing some of that. Denise, I'm just really impressed with the breadth of services that you offer, the free services that you offer, the educational classes, and all of the support that you provide. It really is tremendous, and you should be commended for the work that you do.
Well, thank you. We don't want to be a secret. So we never want to be a secret. So if you know someone who, even I know many of you probably have, kids or young adults, but, even if you know someone who's an adult who could use our support groups or our classes, please just pass it along.
Denise, thank you. Thank you. Wonderful. Well, I'm so happy to introduce our next speaker, Brenda von Rautenkranz, and I will read a little bit about Brenda. She's really amazing. Brenda has over 30 years of professional experience in behavior and education. She is a licensed professional counselor in the state of Maryland, and she operates VR Growth and Learning Center, which is a facility dedicated to bringing horses, dogs, and clients together for emotional growth and empowerment, as well as equine corporate team building for companies of all sizes. And the motto of VR Growth and Learning Center is horses and people. As a motivational speaker and a professional trainer, Brenda has reached thousands over the past 40 years to help them on subjects such as nutrition, emotional well-being, physical fitness, and empowering leaders to help clients gain control of their lives and to inspire them to a healthy road to success. With her cable TV show, which she both hosts and produces, she's been able to spread that same message while highlighting nonprofits and community issues. And today, Brenda is going to talk to us about the interconnectedness of physical health and mental health. Brenda von Rautenkranz, it is wonderful to have you here, and I will pass the floor over to you.
Well, thank you. Come here, Yogi, come. I guess you got to see a dog, right? If not, it wouldn't be VR Growth and Learning Center. So thank you, Yogi, for that. And then of course we have maybe a horse. And so we try to have all obstacles here. My other one couldn't come in right now. So, but I want to thank you for having me. I'm in awe of all of you. I've learned a lot so far because we stay in our own little bubble. Like, wow, there's a lot out here in Howard County, and I love it. So I thank you for that. So a little bit, I love talking about equine psychotherapy. I'm going to talk real briefly about an overview of what I do with the horses. We have 7 horses here. We work with using the horse as a means to approach kids in a different light. So horses, why do we use horses, not rabbits or whatever? We use horses because horses have the same feelings we do. And when we start doing any kind of work, it's hands-on. Horses can really get that behavior really quick to know whether that person is upset, sad, and it is a great storyteller for kids. So I love the piece of the horses. We're licensed to do all that. One of the things that I love about the horse piece is we don't never know what to expect. And most of the horses that kind of approach the kids, they said, why does that horse act so bad? Well, it makes it an opportunity to have one, that they can get on their behavior. We can watch a little bit of how we could tell them what the horse is doing and what they're doing. So it's great for all populations, and I handle from 3-year-olds on up with equine assisted psychotherapy. What I love about the whole horse industry is that we're bringing an awareness that we can use other modalities for psychotherapy. And so I have been encouraging people just to come out and see what it's like and see what the horses have for that. You hear my dogs playing in here. I'm sorry. Anyway, so I'm a personal trainer. I do fitness, and that's what I'm going to talk about today. A lot of times I get some of my students in autism to come to boot camp in the park, which is on Saturdays. It's free. And a lot of kids, they want to participate, but it's very difficult. So I'm going to tell you a little bit of why it's difficult for some autism population. Number one, as we know, obesity is on a rise, but it's even more on a rise for students that have in the autistic world because of certain things. So you say, why is that so? Well, one of them is sometimes the medication makes them a little heavier. They sit a little bit more, especially with COVID. And they're picky eaters. I mean, let's face it, they're picky. And so we have a little bit of that. And then they're less physical. And why are they less physical? And I'm going to talk about that. They're less physical because one, their coordination and their balance is off. And a lot of times their muscle strength is not there. And so they have some fears going on there. For example, I had one child who's older, who's in high school, but he had a fear of going up a curb. And because he tripped, because he wasn't lifting his feet up. So now he didn't want to do any curbs. So what I did was I said, all right, let's practice curbs. So we did curb walking up and down. And he became so really accustomed that he got over the fear. So what I do to interconnect that whole physical piece, I get them aware of some of the things that they can do. One of the things I do is horseback riding. And the one that I talk about, equine psychotherapy, that's the touch of the horse. Then I do riding with some autistic kids. And that's a great one. And I'll tell you why. You're going to love this. One, they get on the horse and they go, oh my, I don't have the strength. And now they want to do some exercises. Oh, you want to do some squats? Well, let's practice some squats. Oh, do you need to do some endurance? Oh, so now they start wanting to do it because they get to ride a horse, which I love because then they're capable of doing some great things for their body. So that's a big one. One of the ones that I have a little hard time with, a lot of times in PE, they'll put some of our students in the autistic population out there with kids and they don't feel connected. So what I do in my personal training here, I work with them like, let's get you walking a little bit more. Let's get you doing a little bit of other things so that you can feel a part of it in some way. One thing that I found out is a lot of times we just have to give them the space to do it. And I like kids to start and I'm going to give you some tips on that, but I like to start small and do little things. So a lot of times the CDC says 1 hour of exercise. I mean, I haven't seen any kid do 1 hour in exercise. I have not. I do it in baby steps and maybe we'll get to a certain amount, but I haven't even seen any adults do an hour lately. But anyway, that's another story. All right, here we go. A little bit of why we want to do this. One reason is I love to see progress, and so do students. So when we start monitoring, well, could you walk for 5 minutes? Can you go to the mailbox? So I get them going to mailboxes or walking around their house or doing some things they're capable of so that they feel confident. That's number one. Number two, the longer they sit, the bigger the stomach. I'm sorry, it just gets bigger as you sit because you sit. So I teach posture and moving and let's get up, let's go do something. So we got to get them active in that way. One of the things I found out, and no one's going to like this, but in the house, if you're not doing it as a parent, I tell you what, it's hard to tell your child to go out and just move around. No, you have to be a role model for them. And a lot of parents just, by the time the end of the day comes, they're done. But I'm telling you, it's well worth it. When they see you do a little walking, they'll do something else too. So I love to see that piece of it. But what are we doing? Are we giving them a lifestyle? What are we giving them? I think it's a daily routine of a lifestyle that they're going to do. Now, what are we doing? We're helping them not get diabetes. We're helping them their cholesterol. We're helping them in overall health that maybe they would probably not take care of if they weren't exercising. So what do you talk about exercise? Brenda, what are you saying they should do? I'm saying find what they like and do it. I had one child, he wanted to do basketball, but he couldn't take the sound. So he put earphones on him, and then I had him exposure therapy. I want you to bounce it 10 times. And then the next day, add one. So he learned how to handle that. And then one day take his earpiece up a little bit. I can hear it. I'm okay. And then we just kept exposing till he could get more times doing it over and over. He started on a basketball league. And that's because we did some of the work here in my office or outside. If we want to promote lifestyle, we have to start making the change for ourselves too. So that's your support, the people that work with your child, have them walk with them, have them do some things. I love this one. You're not going to really like it either, but do some commercial workouts. Oh my gosh, kids watch TV. Here comes a commercial. Let's do 10 jumper jacks. Let's go. And they make it, we're like, oh, come on. But they will start looking forward to it. Yeah, that means you may have to get off the couch too. But a lot of times kids want you to move too, and they like that. So I like getting them to be positive and how they talk about themselves. So I stay on the positive psychology with them. They come in, tell me what they did or didn't do, and then we go from there. I don't really say, oh, you didn't do it again. We just go on from where they're at. Most of the time, nobody likes to work out. Well, okay, some people, but most don't, and more kids don't either. But I say start small. One thing kids don't want to do is get down on the ground and do some yoga or do some sit. They don't want to do that. Well, adults don't either, but kids don't really want to either. I say let's start with that and get them to calm down and do some breathing. My focus this year has been doing a lot of breathing and focusing of where they're at and just being. And when you can do that, they can say, wow, I feel better since I'm doing a whole breath. So we're doing a lot of different things, but the most important is making them feel powerful within themselves. So anyway, wrapping up, take steps small, do it little by little, be the role model for everybody. And maybe, hey, you're going to go out for a walk after this. I don't know. Maybe I inspired you. Come here, Yogi. You want to say goodbye? Come on, say goodbye. Thank you so much for having me. I appreciate it.
Brenda, thank you so much. As a veterinarian, of course, I just love the fact that you bring your animals into it. It's such a unique and creative way to inadvertently change behaviors and get kids and adults to be active, and that really helps with their mental health. I'm so grateful that you got to share what you do, and we really can't wait to hear more in the Q&A. We're going to move on now to Matthew Plantz. Matthew does not need any introduction, but I'm going to give him one anyway. Matthew Plantz is my co-chair. He also calls himself my partner in crime on this committee. And I'm going to read you a little bit about him. Matthew is a self-advocate, and he is a board member at the Howard County Autism Society. He's been an advocate most of his adult life. He began his advocacy career while attending the Maryland School for the Blind. He told me that he was glad to have been diagnosed with autism spectrum disorder because it gave his family something to work from. He is a board member of the Community Advocates Committee at Kennedy Krieger Institute. He is vice chair of People on the Go. He was past president of People Power, also past chair of the County Commission for Disabilities. He is a member of the Diversity, Equity, and Inclusion Advisory Committee through Howard County Public Schools. He recently received the Stanley Seidel and William O. Jr. Memorial Citizenship Award from the ARC of Maryland. That's the second time he's received that award. And he is a 2021 graduate of the Howard County Commission for Disabilities. I believe he just graduated on Tuesday. And today, Matthew is going to discuss the challenges that he faced in 2003 regarding access to services, multiple coexisting conditions, and lack of diagnostics. He's also going to talk about diagnoses, mental health professionals and his professional care team, and his experiences at Waystation. Matthew, take it away. Here's your 10 minutes of fame.
Well, when I was at Maryland School for the Blind before we knew we had stuff going on. I
knew I'd get it wrong.
But had to be checked into for Pratt because no one knew what was going on. And then that's when we found out I had the bipolar 2 diagnosis. One of the biggest challenges, I think, is, and this is also a developmental disability, is when I was born back, I was 26 weeks premature in 1981. No one knew what was going on. They diagnosed me with so much. First they said, we don't know what you have organic brain disorder. And that was some 5 years ago. And then when I was at MSB, they finally gave me a comprehensive diagnosis and said, you have Asperger's syndrome, which is functioning autism. Some of the challenges that have been that not knowing what was going on, my parents were a little stressed and made me more. No, for me, it made me feel like a missed boy. And it made me feel like people were giving me for no reason. They didn't understand me, but after I worked with my team at the school, they really did. They really did help people understand me. And I was referred to. There hasn't been a day I haven't been under some kind of counselors. There's not a day when I haven't seen a counselor. I've been to. I currently see a therapist at Waystation, and I think it's a month or once. Yeah. To just to talk about my anxiety, I mean, I've been doing it virtually since the pandemic because the clinic hadn't been open. But I mean, for a guy who likes to be an this pandemic has not been easy. So, quick, Mary, cover what you want me to cover.
Matthew, no, that's great. Did you want to expand on your experiences at Waystation?
Yeah. Well, my experience at Waystation is very positive. I mean, there's never been when I came out of MSP, there was never a time when I wasn't under care of social workers, psychologists. I mean, there's just not been that real.
Matthew,
I think
we're losing your connection, and I hate to. I wonder, Marianne, do we want to? I don't know. Come back. I hate to lose it.
That's what I'm thinking. Matthew, if you don't mind, how about we'll move on to Mia, and let's see if we can maybe have you log back out and come in.
Yeah.
Okay. Thank you. Matthew, you're amazing. Next, we are going to hear from Mia Williams. She is the mother of 2 sons, the oldest of whom is on the autism spectrum and is in high school. She's a very strong advocate for her son, having served on the parent panel of Towson University's Autism Education Series, parent liaison for special needs students in her son's school. Mia resides in Howard County and serves on the board of the Howard County Autism Society and the Howard County Commission on Disabilities. She's focused on improving opportunities, upholding rights, and creating bright futures for individuals on the spectrum. And tonight, Mia is going to share with us mental health care state of emergency, my firsthand experience. And Mia, thank you so much for offering to tell us something so personal, and we really appreciate you being here and discussing that with us. So I'll hand it over to you. Mia, I think you might be muted.
Try now. Hold on. Hold on, Mia. Try now. Gotcha.
Can you hear me?
Now we can.
Okay. Hi, everyone. Tonight, I'm speaking from a parent's perspective. I'm really happy to see all the professionals here. As Marianne said, I have a just turned 18-year-old. So it's an exciting transitional kind of time for him. You might have seen him earlier. He was sitting next to me, my son, Justin. So I wanted to speak about the mental health care crisis. I didn't really realize there was one until I was in the middle of one, you know. Maybe a lot of other parents couldn't relate to that. So Justin was diagnosed, he was diagnosed at Kennedy Krieger. He's been going there since he's 4, and for his neuropsych evaluations. And he's also been at Sheppard Pratt. So I'm very familiar, like many other parents, you know, going to different places to get different services. And Justin, like Dr. Giuliano, I think that's your last name. My son's diagnosis was PDD-NOS as well. Way back in the day, they don't use it anymore. And it was just developmental delays at first, then PDD-NOS, and mild intellectual disability as well. So at the age of 16, which is where my story is about, there was just a dramatic change with him. And he started becoming physically aggressive at home. And I didn't know what to do, you know, because I had never had the experience. And his psychiatrist always told me that if anything happened, to call 911 or take him to the emergency room. So there got to be an incident where I had to get him to the emergency room, and I couldn't get him to the emergency room. So I called the police, and this was in Baltimore County. And I explained to them, you know, what the situation was and who was in the house, that he was in the house, and that I, you know, wanted them to be calm, you know, when they came in, because I didn't want anything to escalate. And they handled it very wonderfully. By the time they got here, he was calm, and basically they just drove him there, and I followed, and it was fine. But when I got there, you know, we stayed basically overnight, and they offered for him to stay longer. But this being my first experience, I didn't feel comfortable leaving him there because, you know, they said it could be a while before he would be able to be moved somewhere else. And I didn't feel comfortable with that. So we went home that evening. And then maybe a month later, we had another crisis, and we ended up having to go to the ER. And this is where the whole nightmare kind of started, because when we went there, he actually ended up staying in an ER. He had been to 2 different ERs. One had a pediatric emergency department, which was wonderful, where he ended up staying for 5 weeks, 5 long weeks, waiting for a bed at Sheppard Pratt. And so this is that's the thing that, I was talking to Howard County Autism Society as a board member about this whole process, and the thing that I want to work on, because it was the worst 5 weeks of our lives, really, to have him there on a wait list waiting for a bed. And it really kind of depends on when your child comes to the ER, how long the list is. And the unfortunate part is that if you're in the hospital and you take them out of the hospital, then they lose their spot on the list. They go back to the bottom of the list. So even though when you get to the hospital, they might adjust their medications and things might, improve, they're still on that wait list. And if you leave, they go back to the bottom of the list. So you kind of are in a very difficult position to decide, week after week, am I going to stay here and, wait this out? Because while you're there, you might be getting new behaviors as a result of them being there for such a long time, like separation anxiety and heightened anxiety, so you have new problems on top of the original problems that you were there, because they're in a holding pattern for so long, so to speak, to get a bed. And as the other doctor from Kennedy Krieger said, there's a limited amount of beds there. There are like 14 beds there. So you have to wait until someone is discharged before another bed becomes available. And in the interim, you might be offered, like we were offered, for him to go to another hospital in DC, which I wasn't familiar with. I asked around about it, and I was told that I probably shouldn't send him there. So we just kind of remained there. Now, at this time I was working, so I was going to see him in the morning before work, and I was going in the evening after work. And he actually spent his 16th birthday in that unit, So so my hope is that there could be a better process, so that maybe you wouldn't have to wait so long. Some kids never waited that long, but to be in the hospital for 5 weeks is just, it's not good, because then also they get into new patterns, because he was watching TV all day, so he kind of liked it. He was like, his meals are being brought to him. He's watching TV all day. He's kind of getting to know the nurses, and, and then there's a new issue. It kind of becomes a fun thing, some days, and then other days he wants to go home, so it was just very difficult. And so I'm glad all these professionals are here, because we kind of need the help of everybody to try to figure out, maybe there's a way with the system, like even if you're there and you're stabilized and you still need a bed, but if you go home, you won't lose your place on the list, because it's not really ideal for somebody to be waiting for 5 weeks for a bed in an emergency unit. And then when there was another incident where he was in a hospital that did not have a pediatric emergency room. So then he is in an emergency room with all kinds of people. You're exposed to all kinds of people in an ER. And if you're there overnight, he was there for a little less than a week that time, waiting for a bed. Thankfully, I was very happy that it was such a long time compared to the other incident. But you don't really want to leave your kid in an emergency room when you don't know the people who were in, the next room next to them. They have people who are on their way to jail, people who are on drugs, like all kinds of things that they're exposed to. So you don't want to leave them there in the emergency room for any long period of time, but you want to get them the help that they need. So it puts parents in a really kind of impossible position, because you want to get them the help they need, but it's really hard to get them the help they need. So all you professionals, parents can't do it on their own. If you all are aware of the problems that we have trying to get our kids the help that they need, then you can probably be a part of the solution. I know there's a shortage of beds. I am thrilled about the new facility in Howard County. That'll be a help, but I just didn't know that there was a mental health care crisis. And it's not just that, it's with therapists, even with Kennedy Krieger, you have to find the right clinic for your child. And then once you find the right clinic, there's a wait list. It could be a really long wait list. And I know all the other parents know what I'm talking about. And then you finally get one therapist that you like, and they might leave. And it's just, there's a mental health care crisis. And it's very difficult for parents to navigate it. We're looking everywhere we can for the resources that we need. NAMI is a great resource that I'm going to be using more. And, all of the hospitals, but I've been everywhere. I've been to Mount Washington, I've been to Kennedy Krieger, I've been to Sheppard, I've been everywhere trying to get him what he needs, as all of you other parents probably can relate to. And, so I just wanted to give you parents' point of view. Justin is doing very well. We haven't had any crises since then when he was 16, thank God. And so things are better now, but I always want to be working to improve the system to make it easier for all of the parents out here. When we were talking about the police too, Howard County does a really great job with their training, but I was wondering if there was some kind of maybe even an identification card or something that you could show an officer or something, just to identify that, you have a child, an individual, child, adolescent, adult, who has a disability, who might need to be, taken care of in a different way if they're not trained, those are just kind of some thoughts that I had. I was saying maybe a license plate, I don't know, a card that they can carry, because maybe they could just be walking down the street.
Mia, there are some things. We just did a great program on wandering and elopement with Pathfinders, and there are some different things. I'll share those resources on this to make sure we have some stickers at the office for your car.
Yeah.
But I especially appreciate Mia sharing this story. It's something at the Autism Society we hear all too frequently. I had a call from a mom about a week ago, and her son had been in Howard County General for 30 days and waiting for a bed. So it's a familiar story. There is a terrific possibility for some solutions through a GBRICS program, terrific amount of funding with a lot of the local hospitals and the Horizon Foundation getting together to address some of this, which is a national problem.
Yes.
We know that it's not just us, but it does get so tricky when you throw the autism into the mix. And, not every ER is prepared to handle it. Some do better than others. Some do better at sometimes than others. And we certainly are excited about Sheppard Pratt offering some more beds, and we need some more interim solutions. So, so we all know that, and thank you so much, because I know it's not an easy story to share, and I remember when it was happening, and it was hard to see, and hard to see for all of our parents and young people.
Yes.
We are coming up on the hour. I don't want to rush anybody off. I know some people have some questions.
Could I just
yeah.
jump in for 1 or 2 minutes, if I could, because I'm from Sheppard Pratt, and I run the adult unit, and I know exactly what the problems are and know what families go through. And I just want to say that you need to advocate. We advocate with the state, but you need to advocate. You need to advocate with your representatives, both at the state and the federal level, because Sheppard Pratt and all hospitals are shackled by EMTALA law. We have to take people from emergency rooms ahead of anybody else. We're forced to do that. If we don't do that, we will get into trouble with the federal government. So so we can't change that. The legislatures have to change that. Also, the other problem we run into is with DDA and with the school systems, that patients get stuck at Sheppard Pratt because they don't have any place to go. And then, of course, that takes a bed. So we really need your help to advocate to solve these problems. And we're working to solve them, but they really need to feel your pressure to get them solved.
Thank you.
Thank you so much. And that's right. We all need to work together. Absolutely.
Right.
If there are, and there's a question in the chat related to Dr. Wisner-Carlson's comment. What is the law that's needed for change? What is the specific thing that we need to ask for?
Yeah, that's really complicated. It's the law is EMTALA, and it has to do with anti-dumping from emergency rooms, and it specifies that and Sheppard Pratt has to take patients from emergency rooms ahead of any other referrals. So a patient in my clinic, my own patient, I can't get onto my unit if there's somebody else in the emergency room. There's no way around it. What the solution is, I don't know exactly, but it has to come at the legislative level. EMTALA. Yeah.
Thank you.
MTOWA?
EMTALA, I believe, EMTALA.
EMT. Oh, EMTALA. Okay, gotcha. Thank you.
Mm-hmm.
Thank you. Marianne, do we want to take some questions? There's the link that Aaron shared. Thank you, Aaron. And Aaron is with Accessible Resources for Independence, an amazing center for independent living that serves both Howard and Anne Arundel County with all kinds of great programs. She's put some resources there. We will add to the list that we send out to you. Do we want to take some, I don't see any other questions in the chat. We could go from
We have a question right here.
Okay.
This is my husband, Rick Martinson, by the way. He came in after intro. So he is my rock, my support system, and he's the reason I can do this. So have at it, babe. I told him no heckling, but he is allowed to ask questions.
Well, I guess one thing that's really surprising, I'm a newbie to this world. I'm very new. I married Marianne almost 5.5 years ago. And at that time, when she said she had an autistic daughter, I thought that it was somebody who was automatically able to drive a car or something. It was auto something, you know. I didn't know anything about it. And that's probably, I would say, is a vast majority of Americans don't know much about autism or mental health. I grew up in a world that didn't have mental health. At least it was snuffed out, and you didn't even know about it. It was like somebody who just wasn't there, just disappeared. So it's very interesting, and it's very overwhelming. Marianne says, I got to do this, and I was like, what? I don't understand. We have Sheppard Pratt, we have KKI, we have NAMI, we have BR Growth, we have all these different things that you can leverage and use, but I get lost in it. It's very complicated, and as someone new to this whole world, it's like hard to navigate. I'm just wondering, the first question is there a master roadmap somewhere that'll help someone through this, especially that has a child or a young adult that has this condition? It's amazing. There's a lot of services out there, but there isn't any really one roadmap to help you through it all. It's a real labyrinth to me. And I just want something there that the beginner's guide available or something like that. Silence.
Doesn't exist, and you need to make that roadmap. There you go. Put him on the task.
Yeah, that would be great if there was a pamphlet that you could hand a parent, you know, after their child's diagnosis, to say, okay, here's everything you need to know, and the order that you need to do everything. But it doesn't work like that. You have to navigate it all. And I mean, you just have to keep on researching, talking to the right people, getting involved with the right, or I mean, that's my experience. I wish there was a roadmap or a booklet or
The other
something.
thing too that I guess Mia, building on what you talked about, is I'm just amazed how you can walk into a hospital with a broken arm and you get a bed, you go right in, no problem, blah blah blah. But if you have a mental condition, it's like, oh, well, we have only one bed. It's over there in a corner, and you have to wait for 3 days before we can help you. Mental health in this country, as well as around the world, is just as important, that I've learned, than physical health, if not more important, because the dangers it could present to society and everything. So I'm a strong advocate for that, for having equal access for not only physical and mental health in hospitals and other areas. I'm amazed how limited it is and how it's still kind of disdained in the general public.
Well, I think some of the labyrinth is also due to the stigma that we were just talking about. It's, mental health is not treated the same. And so, but it's also incredibly complex too. The health department and the hospital both have people on staff that they call behavioral health navigators. I saw the word navigator come up in the chat, and it just made me think about it. It's not a roadmap per se, but there are people that work to, when you call, and the one at the Howard County Health Department Bureau of Behavioral Health is amazing. She can find, she was providing me with information, and I thought, well, we got to put this in our resource list. But if you have a question about anything regarding behavioral health, she can direct you to the right place. And I haven't had experience with the hospital, but they have several people on staff that do that same thing. As a person is being discharged, they give them resources, they give them some direction. But it's I mean, just like autism is so complicated, so is mental illness. And it is really hard and frustrating. And I often think of the people who English is not their first language. And how incredibly difficult. I mean, we're all struggling, and then you put a language barrier on top of that, or cultural differences, and it can really seem insurmountable. So, I mean, there definitely is a crisis in this country, and certainly COVID hasn't helped. But I wish I could give you that roadmap, or at least a better answer than that. But I think some of it is stigma, some of it is just the complexity. Whereas, when an arm is broken, it's an easy fix, but if you have a brain disease, it's very difficult to understand it sometimes. It's complex. It may need several medications. It may, and each person is different, and how those medications affect you and interact with your body. It's not as easy, unfortunately. But I do think that the stigma plays a part in it, and the lack of parity with health insurance. So that, I know that probably wasn't helpful, but that's all I got.
When I think of roadmaps, I think of NAMI. I think of Howard County Autism Society. I think of Pathfinders for Autism. These advocacy groups, I think, are the places to go to help figure out the way to navigate the system, or who to get to get help to navigate the system.
Thank you so much. I'm going to, Denise, is that navigator, and I apologize for the dog in the background. The navigator is in that link that you sent?
No, that's another resource I neglected to put in there.
Okay.
I can give you the direct phone number. I can send it to you at the health department, her direct line, and she's awesome.
Okay.
And the ones at the hospital I don't believe are the same in the way that you could just call them. You may be able to. I could ask Laura Torres that at the hospital, but my understanding is they're more for sort of discharging. As people are leaving the hospital, they'll put them in touch with different, day programs, and this is available, and NAMI, and so their function is a little bit different. But Leah is incredibly responsive, and has a great pulse on what's available in the whole area, not just Howard County, but the entire area. So she's definitely a great resource. So I'll send that to you, Melissa. I'm sorry about that.
Great, thank you.
Thank you.
We also have the name of other professionals. That was another question that was submitted. And we'll share the transition service resource. Somebody asked about that for mental health through the Maryland Coalition. And I think that got us covered most of the questions that were submitted from people registering. Marianne, do you want to wrap us up here?
I want to thank everyone so very much, to our fabulous presenters, our panelists, for all of the time that you've put into this, that you've dedicated to this this evening, and all the preparation that you did, and for sharing with us all of the tremendous wealth of knowledge and services. This is really incredible to have you all in one place. I have learned so much. I'm sure everyone can say the same. I want to thank everyone who participated, and especially thank Melissa, because without her and the Howard County Autism Society, this event would not have taken place. And Melissa is really a hero to so many people. So I just want to thank all of you. And please feel free to reach out to the Howard County Autism Society or to any of the others that presented today with any questions or concerns. And I hope you all have a good rest of the evening. Thank you.
Thank you. And we'll have the link to the recording and the materials in a few minutes.
Thank you.
Thank you.
Thank you. Bye.